We are joined today here with Dr. Philip Spandorfer, better known as Dr. Pip from drpip.com, as well as North Atlanta Pediatrics. How you doing today, Pip?
I'm doing great, Gil. How are you?
I am good. Thanks for joining and helping us out and helping parents out all around to talk about all things COVID-19 and their kids. So let's start off right away and talk about what do we do with our kids right now as far as coming to the office for visits, well visits, sick visits, all those kinds of things. What are we doing?
Yeah, great question. What most pediatricians are doing around the country is that we're seeing the healthy kids in the morning, and then we'll see sick kids in the afternoon. The interesting thing is we're just not having that many sick kids. So it's, a handful of sick kids and mostly the checkups. We're primarily seeing the young kids who need their vaccines and any other kids who have issues or need something that needs to be addressed. So very important for kids under age 2, maybe even under age 4 to still be coming in, and maybe even a lot of those older kids too should still be coming in for their checkups.
Got it. So parents make those appointments. It's still important to go see your doctor, and all the doctors are keeping the area safe and well kids separated from sick kids and all that good stuff.
Right.
So let's talk about the COVID-19 and how you're talking to parents and how you're talking to kids, because I know you have a great relationship with your patients as well. So talk to me about everything from physical health as well as mental health. When you talk about protecting kids, what are you talking about?
Okay, a lot of questions in there. So protecting kids and what can you do to kind of avoid it? Certainly we know that the social distancing is helping. Washing your hands is helpful in terms of not getting it all at once. People talk about the face mask, and the face mask may be somewhat helpful. The face masks really filter out larger particles, and we know that this virus is a smaller particle and it can go right through the face mask. So the face mask is not doing great, except it keeps you just from touching your face. So that's kind of what we can do to kind of prevent it. I've kind of forgot what some of the other questions were.
Yeah, let me ask you about. So you mentioned the face mask. So kids, I think we all notice that we touch our face probably way too much, and maybe that's a good thing. They'll change. So I imagine kids have their hands all over their face. So you're telling them and parents keep kids' hands away from their face, keep washing them. But certainly the mask is helpful, or at least a covering is helpful when they're outside.
I think it helps you in the sense that there's something on my face. I shouldn't. As a reminder, not to touch your face.
Okay.
If anything.
Great. Let's talk about mental health, because
Yes.
I know, again, you talk to parents and kids. What are some strategies for folks to be thinking about the mental health of their kids?
I think that's a really important part. Kids are very resilient. They're going to do fine if their parents are doing fine. If the parents are kind of in a, oh, woe is me, this is terrible state, then the kids kind of start feeding off on that. But if you tell them, this is fine, we're going to be fine, we're going to make it through this, that's going to be good. Kids thrive on a routine, so try to keep a routine for your kids. Try to do fun and entertaining things. Get them outside as much as possible. Just still keep trying to do, family things. Family dinners are nice, games are nice, and then making sure that they have some structure in their day.
Yeah, speaking of that, Pip, and we didn't talk about this earlier, but since we're also friends, I see you doing these theme nights with dinner with older kids. Is that kind of like a good idea to do with younger kids and get them into it?
I think so. I mean, my kids, it's amazing. My kids love doing these themed dinners. They thrive on it way more than I do. I'm just tag along. They're the ones who want to do it. Of course, they're trying to get all these likes on TikTok and Instagram, but that's
right.
That's beside the point.
I forgot about that. All right,
Yeah.
so let's talk quickly about testing. And I know
Yes.
testing is evolving. Is it different for kids? Because I know the first test I saw, and you see these pictures on the internet of this cotton swab going 6 inches deep into someone's skull. Is that
That's the same
for kids?
test. We take that swab and it goes through the nose all the way back to about right here.
Wow.
And you're just kind of swabbing it. And then you're supposed to go on the other side too. Kids hate it. Not that we've tested that many. We had a couple of those swabs. We don't have any more. The test kits just are not available. They were not forthcoming like we thought. But that's one to test can you pick up the virus? Is the virus even detectable? Then there's another test which might be actually helpful, and that's a blood test, maybe even a finger prick that will tell us, do we have antibodies to the virus, meaning are we protected, have we already had it, and we were one of those asymptomatic people. So those are the two tests that are out there. Can you detect the test, and then do you have protection against the test?
Gotcha. And
Neither of which we have right now, by the way. I don't
Okay.
mean to interrupt you, but neither of which we have.
Hopefully we'll have them soon. It'll be easier for everybody. And so let's wrap up and talk about ending. And I know everybody pays attention to press conferences and hear different things, but would love your perspective on how much, maybe not how much longer, but what can we look forward to coming up?
Great question. I think that's probably that's one of the most important questions and one that I get asked the most. When will it end? I think we get back to normal, where I can give you a handshake, or we go out to dinner when there's a vaccine, and it's going to be a year before there's a vaccine. That's my guess. Okay. The other things that would have to happen, we have a good medicine to treat it. So maybe the medicines that they keep talking about are helpful, and that might be enough to kind of abate the symptoms and keep you from going into the severe respiratory distress. And that would be enough for us to kind of start doing that. And we don't have that data yet. Or if we had enough ventilators and good critical care medicine that we would be able to save people. Right now, there's about an 80% death rate if you get put on a ventilator. So it's not even, the lack of ventilators. It's just once you get to that point, it's bad.
Yep.
So I think we're looking for vaccine. I think it's a year. Could be medication. And that's when we kind of get back to normal.
Got it. Well, Pip, we really thank you for your time. Again, if you're in the Atlanta area and you want to see Pip, you can check out his website, drpip.com, and also northatlantapeds.com, where he practices with other docs. Pip, thanks again for your time. Be well, be safe.
Thank you. I appreciate your time.